Good morning, everyone. I'm Dr. Bharat Chauhan, cancer specialist for Mumbai. Today, we'll be talking about a very important topic which is affecting the lives of all of us, the impact of COVID on cancer. So, we'll be dwelling upon it in great detail, how a cancer patient should behave and how a physician should behave in this pandemic. First and foremost, if a newly diagnosed cancer patient comes to us, so patient should initiate treatment. There should not be any panic that he can delay treatment or he can hold treatment till the pandemic is over. There are various studies which suggest that once you are diagnosed with cancer, you have to start treatment as early as possible. Delaying treatment even by 1 month will affect your cancer treatment outcomes, will also increase mortality. So we have to see, if you are diagnosed in this pandemic, you have to get yourself treated properly. You should not be dwelling upon the panic part. So that part is clear. So the second category of patients which we are dealing with, those who are already on cancer treatment and suddenly they are struck with this pandemic. So what do they do? So many queries were raised. I received many questions from my patient. Doctor, should I hold treatment? Should we wait for the pandemic to over? Should we stop treatment? That was another alarming question towards me. And one more important question I received was, can we switch over to some oral treatment rather than taking this injectable chemotherapy? Or there is some less intense treatment which can be managed at home, so that I should not come out of the home and risk myself for COVID infection. These are all questions again related to risk of getting COVID, risk of getting life affected by COVID. So the answer is clear. We can't change treatment. We should not compromise the cancer treatment. It will compromise the outcome. We should not play with the life. That's very, very important. So what do we do? If you are on chemotherapy, you should continue chemotherapy as advised. There is no alternative. That's one, with due precautions. Second, if you are due for surgery, with due precautions, you should undergo surgery, get your COVID tested before surgery, get your surgery done, then you start your adjuvant treatment, which may be chemotherapy or radiotherapy. It should not be delayed. It will be detrimental for the cancer treatment outcome and for your life. And the third part regarding radiation, which I have already answered, we should continue radiation, we should continue chemotherapy, and we should continue surgery. So other thing is, while we are doing chemotherapy, one can use growth factors so that it will boost the immune system of the patient and they will become less prone to infections, notably COVID infection. So one should have a generous use of growth factors during chemotherapy, especially in all patients, so that they are being taken care of. Now, third category of patients which we will discuss is those who are on follow-up. How do we follow up? So if you are on follow-up, it's a very, very important part of cancer management, because during follow-up, your chance of disease coming back, your recurrence is being detected. So you can't be complacent. So if you are in far-flung areas, get in touch with your doctor with a teleconsultation or a video consultation. If required, if doctor is having some suspicion or some issue, then you can even visit the doctor. But there is no need for a physical follow-up at this crucial time. That can be tackled on teleconsultation or video call. Other thing is, those patients who are on some sort of a tablet cancer therapy, how do they behave and what should be done for them? If you are on any kind of maintenance treatment or tablet treatment, which you are taking for your cancer, please continue taking those tablets. Please continue taking those tablets, continue your treatment. Should not hold just because there is a COVID outside, so you should hold your treatment. No, you should continue treatment, you continue maintain and get yourself regularly checked through tele or video consultation with your respective doctor. And as and when required, assessment, regarding assessment, if you are on follow-up or on maintenance, assessment can be delayed if the physician feels that everything is all right on teleconsultation as well as on video call. Assessment like imaging can be delayed till the time physician is comfortable, so that you are not exposed to the risk of COVID while going out. So that can be delayed. Now so tablets you have to take. There is no doubt you can't stop those tablets. These are your lifeline, so you should continue those. Now, important question is, suppose if a cancer patient catches COVID, what happens next? How do we deal with it? So if a cancer patient catches COVID, let's start with each category. If you are a newly diagnosed cancer patient, how do you behave and how do your physician behave? Simple. You have to take treatment of COVID. You have to be quarantined. You have take treatment of COVID. Take repeat COVID test as and when required. First after 7 days, second after 14 days. If your COVID test is negative and your quarantine period is over for 14 days, then you are eligible to start your cancer treatment. That is one part. If you are not in a life-threatening scenario or you are completely asymptomatic. Now the other scenario is if you are newly diagnosed and you are symptomatic, you are having severe pain, other problems, then with due risk you should undergo surgery with COVID precautions. There has to be a COVID hospital, doctors should be taking proper precaution, and you undergo surgery. Then that can be tackled. But for chemotherapy, one can delay chemotherapy till your quarantine period is over or your COVID is negative. But suppose there is a situation in which you are very much symptomatic and chemotherapy is required, there is no role of surgery in that situation, then you should give chemotherapy. You should not wait, because in many lymphomas there are huge tumors, large tumors, patient is wincing in pain, and there is patient is having respiratory compromise due to large tumor in the chest. So in those kind of situations, one should start chemotherapy as soon as possible with COVID treatment side by side with quarantine facility and isolation, and with COVID precautions for the physician team. So that will be your chemotherapy part and surgical part in a COVID patient.